Today I'm going to be telling you about the cranial nerves 1 through 12. I'm going to be talking about whether they're motor, sensory, mixed function, and if they're important for speech and language. So let's begin. I'm also going to talk about how to assess them. Let's start. Cranial nerve number 1 is olfactory. The olfactory nerve is a sensory nerve. Its main function is smell. So you can assess this by having the client smell coffee beans. You can ask them if they've haven't had any changes or deficits in their sense of smell, etc. This is not an important nerve for speech and language. All right, cranial nerve number 2 is the optic nerve. So the optic nerve is sensory, and it just receives vision information. That's its only function, is vision. And it is not important for speech and language. You can assess this by having the client follow a moving target. And when they can no longer see the target, you know that's where their visual field is impacted. So moving on to number 2 is sensory. The optic nerve is not important for speech and language. Moving on to cranial nerve number 3, which is the oculomotor nerve. This is a motor nerve. It controls eye movement and upper eyelid elevation. It's not inherently important for speech and hearing. And you can assess this by, again, having a client follow a moving target. You can have them, tell you about if they've had any problems with their upper eyelids elevating. Essentially, performing an eye exam and getting them to follow a moving target will tell you a lot about how their vision is, and how they can control those eye muscles. So moving on to number 4, the trochlear nerve, which is again another eye muscle. It's a muscle nerve that controls eye movement. Not important for speech and hearing. Again, this can be assessed by an eye exam or having them follow a moving target with your finger. Have them cover an eye and just try to focus on that. The muscle movement of the eyes is how they can be assessed. So next, cranial nerve number 5 is the trigeminal nerve. This nerve is mixed. It's pretty important. It receives sensations from the anterior 2/3 of the tongue, proprioception from the jaw, and the muscle aspect of the trigeminal is very important as it innervates all the muscles for mastication. So chewing, that's significant. However, the trigeminal nerve is not inherently important for speech and language. This can be assessed with taste. You can ask, not taste, excuse me. This can be assessed by having the client close their eyes and see if they feel sensation on their face or their jaw. And chewing. Chewing assessment is how you can assess the trigeminal. Next up is the abducens, another eye motor nerve. So this is not important for speech and language as its only function is to abduct the eyes, so laterally and, down and out. This can also be assessed the same way the other eye cranial nerves can. Follow a target. For abducens, if the client's eyes appear to be crossed, both pointing inward, that could be a sign of damage as the abducens are not functioning and keeping them straight. So that's how you can assess the abducens. So moving on to number 7. Cranial nerve 7 is the facial nerve. Very important nerve. It's mixed, so that means it has sensory and motor functions. So the facial nerve, its most important function, muscular function, is it controls all of the muscles needed for facial expression. So sensory wise, it controls secretion in the face. It controls facial, so that means it does taste from the anterior 2/3 of the tongue. to assess this, you can ask them if they've had any change in taste in the anterior 2/3 of the tongue. And then ask also to assess the facial nerve. Very important. You can ask them to make facial expressions, puff their cheeks, smile, frown, all kinds of expressions to see what they're working with their facial nerve. So yes, facial nerve is important for speech and hearing because we naturally make facial expressions when we talk, and that's actually a very important aspect of communication. Moving on, number 8 is the vestibulocochlear nerve. This is a sensory nerve. It mainly has to do with equilibrium and audition. So this is very important for speech and hearing because it's all has to do with hearing. So to assess the vestibulocochlear, have the client close their eyes and try to balance. Make sure that they don't fall over though, give them that support if they need it. And then you can also rub your fingers very close together next to their ear and see if they can perceive or hear that sound. That's a way to assess the vestibulocochlear. So again, very important for speech and language as it involves hearing. All right, moving on to glossopharyngeal. The glossopharyngeal is cranial nerve number 9, and it's a mixed nerve. It perceives sensation from the posterior 1/3 of the tongue, so that gag reflex, like back in there, and it receives sensation from the middle ear and the soft palate, so that's important for speech, tongue placement, all of that. The glossopharyngeal, that can be assessed by assessing the patient's gag reflex. Let's see, what else? Or tongue. So you can use a tongue depressor and kind of gauge the strength on each side of the tongue, press down, see how much pressure they can apply to it, etc. So glossopharyngeal, very important for speech and hearing. Moving on to number 10, the vagus, super important nerve. It's a mixed nerve. It is mostly sensory, but it does have a small motor component. So it innervates essentially from the pharynx down to visceral organs in the abdomen. It innervates pharynx, larynx, heart muscles, blood vessels, the esophagus, and like I said, visceral organs like intestines. So the vagus nerve is pretty extensive. It's responsible for perceiving nausea and stuff like that. It controls the muscles of the pharynx, the larynx, everything needed for phonation and resonance. So the vagus nerve is a very significant nerve when it comes to speech and hearing. This nerve, like I said, it's mixed, so it has both components, motor, sensory. It can be assessed, let's see, it can be assessed by an oral motor exam because you're going to have to, say, and then assess the client's larynx, pharynx, that cavity, to see what's going on regarding their larynx, their phonation processes, resonance, that kind of thing. So that's going to take an oral motor exam to look and see, is how you assess that. So again, like I said, the vagus nerve is super, super important for speech and hearing, mainly speech and language, because it does control the larynx, pharynx, all of this needed for speech specifically. So moving on to the next one, the next nerve is after the vagus comes the spinal accessory. The spinal accessory nerve is a motor nerve, and it controls head and shoulder movement. So one way to assess this would be the clinician applying pressure to the client's shoulder, having them turn their head, and you apply pressure to the opposite shoulder. Just gauging how much they can elevate it or really move it will assess the spinal accessory nerve. This nerve it's just motor. It's not important for speech and language necessarily. Moving on to the last one, the last cranial nerve is the excuse me, it's the hypoglossal. And this is important for all tongue movements. It's a motor nerve, and it is, it controls all tongue movements. So this one can be assessed by tongue depressor, gauging strength, and then also having the client stick their tongue out, you know, side to side, that kind of deal. Just assessing their range of movement with their tongue, because this muscular cranial nerve, it innervates the tongue, and it has all to do with tongue movements. So as you can imagine, this is a very important nerve for speech and language, because we use our tongue so much in so many different ways during speech that the hypoglossal nerve is very, very important. So just to reiterate one more time, cranial nerves 1 through I think 6 are not, they're not important for speech and language inherently, but cranial nerves 7 through 12 minus the spinal accessory are very important for speech and hearing. So that's like half of the cranial nerves that we absolutely need for speech and language. So yeah, I hope I addressed all of the assessment requirements. And yeah, have a good one.